I'm washing my hands. Good morning, my name is Kathy.
Good morning.
I'm an NP student from ODU, and I'll be doing your exam today. I verified your name and your date of birth. Okay. First, we'll start with your head. We're looking at the skull. Looks nice and symmetrical. I'm going to palpate for any bulging, abnormalities. Looks great. Now I'm looking at your face. It looks even and symmetrical. Then I'll move on to your hair and scalp. Your hair is evenly distributed, it's dark brown. I'm looking for any lesions, nits, or flaking. Looks good. Now we'll look at your skin. All right, it is warm, dry, and intact. We'll look at skin turgor. Looks good. And then move on to the nails. It's pink, dry, clean, intact, no clubbing. Okay, now we'll move on to your eyes. We're looking at your eyebrows and your eyelashes. They're full, no thinning. Looking at your eyelids and your lens. Looks good. Your sclera is white, if you can pull it down on your lids. Conjunctiva is pink. Good. Now we'll do the visual acuity test. Okay, with your left eye covered, please read the smallest line you can 6 feet away.
DHJBS.
All right, we're gonna switch eyes. Please read it backwards.
XBJHD.
Okay, thank you. All right, now I'm looking at extraocular eye movement. And then please follow my finger with your eyes without moving your head. Okay? Perfect. And now moving closer to your nose, checking for convergence. Good. Now we're checking visual fields. If you can cover your left eye. All right, please tell me how many fingers I'm holding up.
2, 1, 2, 3, 1.
Okay, other eye.
2, 1, 3, 2.
Good. Okay, now I'm checking pupillary response. Just look at my nose. Bright light. Good. Now if you could turn. I'm looking from the side. I'm looking at the anterior chamber and at your lens. There's no cloudiness. And then the other side. Looks the same. Perfect. I'm gonna dim the lights. We'll move on to the ophthalmic exam. Okay. Please look at that fixed point, that TV across the wall. All right, maybe 15 inches away. All right. I'm looking at the posterior structures of the eye, looking at the optic nerve and optic disc. Moving in closer, looking at the 4 quadrants of the trace vessels. Okay. Now look directly into the light and observing your macula. And then we'll switch eyes. Okay. Again, please look at that fixed point, that chair over there. Okay. I'm looking at the posterior structures of the eye, the optic nerve and the optic disc. Now I'm looking at the trace vessels, the 4 quadrants. And please look directly into the light as I observe your macula. Good. Okay. And turn the lights back on. Okay. Next we'll move on to your ears. I'm going to palpate the ear and the area behind it, and the other side. Good. Now we'll do the TMJ. I'm gonna hold right here. If you open and close your mouth a few times. Looking for any clicks. Good. And then we'll do your sinuses. This is the frontal with firm pressure, checking for any tenderness. Frontal and then mandibular. Good. Okay, now we'll do your hearing test. If you could scoot up a little bit and cover your right ear. I'm gonna whisper 3 words. If you can repeat them back to me. Chair.
Chair.
Car.
Car.
Banana.
Banana.
Okay, we'll do the other ear. Red.
Red.
Coke. Thank you. All right. Now we'll do the nose. If you could occlude one nostril, we're going to check for patency. Breathe in and out a few times. All right. I have to go back and look inside the ears. Okay. All right. Looking inside, going up, out. Looking at your tympanic membrane. It is pearly, and there's a good cone of light. We'll check the other side. Looks the same. Thank you. I'm going to switch the tips. Now look into your nostril as well. Okay. And tilt your head back. Lift your nose up. And look for any polyps, bogginess, edema. And the other nostril. Both look great. Okay. Now we'll go on to your mouth. I'm looking at your lips. It's nice, moist, and pink. If you could open. I'm looking at your teeth. Nice, white, no missing teeth, no cavities. I'm looking at the roof of your mouth, the base of your mouth, underneath the tongue, inside the cheeks. Good. I'm looking at the posterior pharynx. I'm gonna have you say ah. I'm looking at the elevation of the palate. Perfect. Looks great. All right. Next, we'll go onto your neck. We're gonna feel the lymph nodes. Okay. We have the preauricular, posterior auricular, occipital. We have submental, submandibular, tonsillary, superficial cervical, posterior cervical. And if you can shrug your shoulders up, you have the supraclavicular. Okay, thank you. Now we'll go on to your thyroid. I'm gonna feel the isthmus and the lobes on the side. If you could swallow a few times while I feel it as well. Good, thank you. All right. Now I'll percuss and listen to your lungs. We're gonna start with the posterior side, okay? Can you unbutton your shirt? And I'll do it on the skin. Okay, I'm gonna turn you more as well, so you're in the field. A little more. Yep. All right, I'm gonna percuss. And then I'm gonna auscultate. I'm gonna have you lift up your arms and take a deep breath in and out, only through your mouth, okay? Deep breath. Good. Now I'm going to do this side, the right side. I'm going to turn you a little bit. Okay, on the right side there's 3 lobes. So, now we'll listen. Again, deep breaths in and out through your mouth. Thank you. Now we're going to do the left side. And there's 2 lobes. Lift up your arm. And then I'm going to listen as well. Again, deep breaths in and out through your mouth. Good. Now we'll do the anterior. And I'm gonna listen. Yep, same thing again. Sounds great, and that concludes our exam. Thank you so much.
You're welcome.